Hey, peace be to you all. Assalamu alaikum. This is Omar Abdul Malik, physician assistant and health educator. It is COVID week 7 or 8 or 9. I've lost count. Today is March 24th, Tuesday. So I just got off from work. I had some shopping to do before I came home. I wanted to talk to you guys briefly about how I'm dealing with this COVID-19 pandemic. It's very challenging. I was talking to my coworkers at the hospital last night, and we were saying, we've got these ordinances from politicians based on expert advice, and that tells you to do things to try to avoid getting the COVID-19 virus and spreading it. Things like social distancing. But then we're in the hospital. We have to work with the patients. That's so you're breaching that 6-foot social distance length. We're we don't have masks like we used to. I've been fitted for my N95 mask. If you follow me on Instagram, you saw something about that. But that mask isn't good for multiple uses, and certainly not for long periods of time. So now there's a mask shortage all over the place at hospitals all around the country, and we may run out of gloves at one point. I don't know. But, when I see patients, one of the ways in which this COVID-19 is affected the way I practice is I really try to not to physically interact with patients very closely. Now, obviously, the certified nursing assistants and the patient care technicians, they're the ones that have got to clean the patients off, turn them every 2 hours, feed them. So there's a lot of contact there. For me, as a physician assistant, if I'm doing rounds, if I don't have to touch the patient a whole lot, I try to avoid it. I had an admission last night, so I had to examine the patient, but I try not to spend an inordinate amount of time examining them. And this is really more a precaution for the patient. We treat very, very high risk. We treat the patients who are at highest risk. So they're elderly. Many of them have respiratory failure. They're on ventilations. They're on mechanical ventilation already. They have a tracheotomy. They've had trach tubes in place. Some come with infections, and they're on antibiotic regimens, so bacterial infections usually. And they've got multiple morbidities, so long-term diabetes, hypertension, COPD. Their status post strokes, so cerebral vascular accidents, myocardial infarctions. Many are status post recent surgeries. So they're at higher risk. They're at the highest risk in terms of looking at the overall patient population. So I really am trying to protect them. I don't want to give them anything. We've already seen in the news where there's been some clinicians who have been infected. They're infected with the COVID-19 virus, and they've been seeing patients. There was an article in the Washington Post this weekend, and it was somebody was interviewing a clinician who had been diagnosed with COVID-19, and she was talking about the guilt that she felt in the possibility, the very high possibility, that she had actually infected some of her patients with it. You don't know. I mean, so many of us can be asymptomatic carriers. Right now, you may hear the birds in the background. It's spring, basically. We've had unseasonably warm weather, at least here in D.C. So the flowers are blossoming. The trees the trees are budding. All of these wonderful pollinators, birds and bees, and other moths and butterflies. There's pollen they're flying all over the place. So there's pollen in the air. How do you know if the sniffle that you have isn't the COVID-19 or if it's just seasonal allergies? If you work out or I'm over 50, so I wake up with muscle aches and fatigue, especially if I've had a rigorous workout session the day before. So you kind of like oh my God, do I have it? Do I not have it? One of the things that we're doing at work is our administration has implemented more stringent screening processes. So you have to sign. You've got to read through and sign a questionnaire every day. Do you have a fever, muscle aches, fatigue, I think sneezing or dry hacking cough? If you traveled outside the country, in particular to particular countries, then you've got to have your temperature checked. And if it's over 100, you're sent home. Sometimes I'm so tired, I feel like, come on, 100. But just kidding. But this is how we're trying to deal with it. Now, does it do any good? I don't know, but I think that we have to try our best to make some semblance of a concerted effort to kind of curb this thing. You don't want to be like I think by now many of you all have seen the videos of the young, very, very, very young adults at spring break. Like, dude, if I get it, I get it. I'm not even worried. I'm out here hanging out with my friends, and we're going to the bars, man. We're having an awesome time. We're not even worried about it. Yeah, spring break. And you're looking at these grown kids, quote unquote. Like, what are y'all doing? But I think this is part of the thought process of the impetuous youth. But then you don't want to be extreme where you're walking around wrapped in plastic or sequestering yourself in the bathroom or the basement of your home or something. It's we've been asked to stay at home as much as possible, but for some of us it's just not practical. My oldest two children work, so they're in the service industry, so they're asked their employers ask them, like, can you come to work? We need people to cover. So we're all just doing the best we can. You got to go shopping. I went and got this Brita water filter. What I've been trying to do is I'm just going about my activities of daily living. If it's shopping, I had to put gas in my car. I've at least been trying to use gloves. I've been trying, when I go shopping, I try not to pick things up. We pick stuff up and put it down, especially if it's produce. If I pick something up, I say, all right, I have intentions of buying this. I go shopping early in the morning or extremely late at night, right when the store closes, much to the checkout people's chagrin. But just trying not to be in heavily crowded places. I think I went shopping earlier this week. There might have been 20 people in the store. But it's important, until we figure out exactly what's going on, and I don't think we ever will know exactly what's going on, but there's a lot that we can do to curb the spread of this virus and try to take care of ourselves and take care of each other. So, having said that, I plan to beat this. This is my pet virus here, a good model of a virus. But anyway, I wish you guys the best of success in your positive endeavors. If you have any interest in being a physician assistant like myself or a health educator, please subscribe to my channel. I'll try to answer your questions to the best of my ability. Okay, peace. Be well.